Maximize health benefits of walking. Fast versus slow. How pace impacts your well-being. Here's a shocking truth that might completely change how you think about your daily walks. You've probably been doing it all wrong. Most people believe that simply logging more steps or walking for longer periods is the secret to unlocking walking's incredible health advantages. After all, we've been told countless times that walking strengthens cardiovascular health, helps regulate blood sugar levels, torches calories to support weight management, and enhances overall muscle definition. These benefits are absolutely real and well documented. But here's where it gets controversial. What if the duration of your walk matters far less than how fast you're actually moving? This game-changing perspective has emerged from recent scientific investigations that challenge everything we thought we knew about walking for health. The concept, which has gained tremendous popularity through what's now called Japanese walking or interval walking, suggests that varying your walking speed, rather than simply walking longer, might be the key to maximizing your health returns. And this is the part most people miss. The research backing this approach is absolutely mind-blowing. Dr. Wei Zhang, a distinguished professor and director of the Vanderbilt University Epidemiology Center, spearheaded a groundbreaking investigation that was published in the American Journal of Preventive Medicine. This wasn't just another small-scale study. Dr. Zhang and his research team analyzed data from an impressive 86,000 participants over a remarkable 17-year period. What makes this study particularly fascinating is how comprehensive it was. The researchers didn't just track walking habits, they dove deep into participants' complete lifestyle pictures. They examined daily walking routines, dietary patterns, smoking habits, alcohol consumption, and numerous other health-related behaviors. Then, they meticulously tracked mortality rates and correlated these outcomes with specific walking patterns. The results were nothing short of extraordinary, and they might make you question everything you've been told about exercise recommendations. Participants who maintained a faster walking pace for just 15 minutes daily demonstrated significantly lower death rates compared to those who walked at slower speeds throughout the study period. Now, before you jump to conclusions, it's important to understand that both groups, fast walkers and slow walkers, experienced reduced mortality risk. However, the reduction was dramatically more pronounced among those who consistently incorporated brisker walking into their routines. What makes these findings even more compelling is the demographic Dr. Zhang specifically chose to study. This wasn't your typical exercise research population of affluent, healthy individuals. Instead, approximately half of the study participants earned less than $15,000 annually, and 2/3 identified as Black Americans. This demographic selection was intentional and crucial. As Dr. Zhang explains, these population groups face disproportionately high risks for serious health conditions, including diabetes and hypertension. The fact that such a simple, accessible intervention, walking faster for just 15 minutes, could significantly impact mortality rates in these high-risk communities is not just scientifically interesting, it's potentially life-saving. This represents an incredibly low-impact, virtually cost-free method for improving health outcomes in communities that often face barriers to accessing expensive fitness programs or gym memberships. Now here's where the current health establishment might disagree with these findings. Government health guidelines currently recommend moderate exercise for at least 30 minutes on most days of the week. Dr. Zhang's research suggests that even half that duration, just 15 minutes daily, can provide substantial health benefits when performed at the right intensity. This revelation should be incredibly encouraging for individuals who are currently sedentary or find the prospect of starting a comprehensive exercise program overwhelming. If you walk just 15 minutes a day, which is below the recommended level of exercise, you still benefit, Dr. Zhang emphasizes. This challenges the all-or-nothing mentality that often prevents people from starting any exercise routine at all. But here's the nuanced part that many people overlook. While participants who walked at the fastest pace experienced the greatest mortality reduction, those walking at slower speeds still demonstrated meaningful health improvements. This finding suggests an incredibly practical approach to enhancing your walking routine. If you're currently walking at a comfortable, leisurely pace, you don't need to completely overhaul your routine. Instead, you could gradually incorporate brief periods of faster-paced walking into your existing regimen. Think of it as interval training for walkers, alternating between comfortable and challenging paces to maximize health benefits. This interval walking concept isn't entirely new in the broader fitness world. Interval training has been a cornerstone of effective exercise programs for decades. However, Dr. Zhang's research provides compelling evidence that these same principles apply beautifully to something as simple and accessible as walking. The implications of this research extend far beyond individual health choices. It challenges us to reconsider how we approach public health recommendations and whether we're inadvertently creating barriers by setting standards that seem unattainable for many people. So here's my controversial question for you. Are we doing more harm than good by promoting the more is better mentality when it comes to exercise? Should health authorities be emphasizing intensity over duration in their walking recommendations? And here's an even more provocative thought. If just 15 minutes of brisk walking can significantly impact mortality rates, what does this say about our society's obsession with hour-long gym sessions and complex fitness routines? Are we overcomplicating something that could be elegantly simple? I'd love to hear your thoughts. Do you think the fitness industry has been misleading us about what it really takes to improve our health? Have you experienced better results from shorter, more intense walking sessions compared to longer, leisurely strolls? Share your experiences and opinions, especially if you disagree with this research or think there are important factors being overlooked. Boost your health by walking faster. The surprising benefits of speedy strolls. Speeding up your walking pace can dramatically enhance your health. More than just putting one foot in front of the other matters. Any walking benefits your well-being, but deliberately increasing your speed offers powerful advantages. And the best news is that it's never too late to start training yourself to walk faster. A recent study published in PLOS ONE reveals something fascinating. Frail, older adults who intentionally increased their walking speed significantly improved how far they could walk in 6 minutes. Frailty, a common condition affecting between 5 and 17% of older adults, is marked by symptoms like tiredness, reduced strength, and unexplained weight loss. This research shines a light on how simple but purposeful changes in walking can make a big difference. Daniel Rubin, the lead author of the study and an associate professor specializing in anesthesia and critical care at the University of Chicago, emphasized the importance of workout intensity regardless of age. It's totally fine to break a sweat, feel your heart race, or breathe harder, even at 79 years old, Rubin said. This challenges the often-held belief that older adults should always move slowly and gently. But here's where it gets controversial. Many assume that all walking is equal, but this study shows that pushing yourself just a bit more to walk faster can stave off signs of frailty, such as slowness, fatigue, and weakness. Walking is an accessible, low-cost exercise, making it an ideal choice to maintain and improve health. In fact, when older participants increased their pace by about 14 extra steps per minute above their usual speed, the health benefits became clear. Margaret Danilovich, senior author of the study and director of clinical strategy at Taylor Care, points out, this might seem like a small change, but it's exactly that nudge, picking up your speed just a little, that unlocks those valuable benefits. To give more context, the researchers studied 102 older adults with an average age of 79, mostly living in retirement communities around Chicago. The group consisted mainly of frail individuals, over half relied on a cane or walker, and they were generally not very active, averaging around 3,700 to 3,800 steps per day before the study. A key method for measuring exercise intensity in this study was through walking cadence, which counts the number of steps taken per minute. Rubin explains that cadence is a practical and straightforward way for older adults to gauge their effort. Unlike heart rate monitors or the talk test, seeing if you can still talk while exercising, which can be inconsistent or subjective, counting steps per minute provides an objective metric. In the trial, participants were split into two groups assigned randomly by retirement community. One group walked at a casual, comfortable pace, while the other pushed themselves to walk as fast as was safe. Both groups followed the same progressive training routine, involving warm-ups, stair-stepping, wearing ankle weights, and walking in various directions 3 days a week over 4 months. On average, the faster group walked around 100 steps per minute, compared to 77 steps per minute for the casual group. After 4 months, those putting in greater intensity showed more significant improvements in physical function, measured by how far they could walk during a 6-minute test. Danilovich summed it up. Every step you take is good for your health, but if you truly want to get the most benefit, stepping up the intensity by walking faster is the key. Notably, researchers walked closely alongside participants to ensure safety and participation, which raises an interesting question. Would older adults see the same results if walking faster without supervision? This is an area ripe for further exploration. The research was supported by the National Institute on Aging. Roger Fielding, a senior scientist at Tufts University who was not involved in the study, agrees cadence is a handy tool for older adults to monitor and adjust how hard they're working during their walk. But he stresses that any exercise beats none. Even walking at an easy pace provides meaningful health benefits, but walking faster amplifies those gains. Fielding also points out that frequency, intensity, and duration all play critical roles in any form of exercise, be it walking, swimming, or running. When it comes to step counts, experts like John Shuna from Oregon State University recommend aiming for about 7,000 to 8,000 steps per day. Contrary to popular culture's fixation on 10,000 steps, there's no definitive magic number. And a recent meta-analysis of 57 studies shows benefits begin around 5,000 to 7,000 steps, linked to reduced risks of death, dementia, and heart disease. If you're currently far from this target, the advice is simple. Increase your daily steps gradually by about 500 each week to build up safely. So how do you actually increase your walking speed? First, get to know your usual route and its distance. Jennifer Schrack from Johns Hopkins recommends driving or measuring your walking path, then timing how long it takes to see your current pace. Next, try using a metronome app on your smartphone to keep track of your step frequency. Rubin suggests matching your steps to the metronome beat at your usual pace, then speeding up by 5 beats per minute to challenge yourself gradually. Most people of average height walk at roughly 1.1 to 1.3 meters per second, about 3.6 to 4.3 feet per second. Walking noticeably slower than this can often signal underlying health issues, warns Jennifer Brack, a physical therapy professor and co-author of the study. She emphasizes that slowing down isn't a normal part of aging, and we should encourage older adults to maintain a brisk walking speed. Another effective tip is incorporating short bursts of high-intensity walking into your routine. A popular form of interval training called Japanese walking involves alternating 3 minutes of fast walking with 3 minutes at a leisurely pace over about 30 minutes. If you walk on a track, try walking slower on the curves and picking up your pace on the straight stretches. Brack shares her own experience. It's easy to fall into a habit of just strolling during your daily walk, but by consciously increasing your cadence, you boost the intensity, and that's been linked to better health outcomes. Now here's a question to ponder. Should walking speed become a standard health marker for older adults? Or could pushing too hard carry risks we're not fully understanding yet? Share your thoughts and experiences. Do you think walking faster can truly combat frailty? Or might there be other factors we should consider? Your insights could spark a valuable discussion for all ages, aiming to stay healthier through movement. 15 minutes a day. How brisk walking reduces death risk and boosts lifespan. A daily 15-minute brisk walk could revolutionize heart health. For millions of people, hitting 10,000 steps a day is a common goal. But new research suggests we should focus on the pace rather than the number, according to a groundbreaking study. The study found that a brisk 15-minute walk could slash the risk of death by 19% and boost heart health, challenging the traditional view that just any form of exercise matters. Led by U.S. researchers who analyzed data from over 79,850 adults in low-income communities, the study revealed that even a short, fast walk, 15 minutes per day, was more beneficial than 3 hours of slower walking, even when accounting for overall physical activity levels. Experts argue this highlights the power of brisk walking as a low-impact, accessible form. This finding comes amid alarming data from last year, which showed that cardiovascular-related deaths had reached their highest level in over a decade. In the UK, around 420 working-age individuals die annually from heart disease, equating to 21,975 yearly. The study, published in the American Journal of Preventive Medicine, tracked participants' walking speeds over nearly 2 decades, categorizing activities like commuting or walking the dog as slow, while more intense moves like climbing stairs or brisk walking were labeled fast. The study found that a 15-minute fast walk reduced all-cause mortality risk by nearly 20%, with the greatest benefits seen for cardiovascular diseases. Professor Wei Zheng, a leading expert, explained that brisk walking improves heart efficiency and reduces obesity, which in turn lowers the risk of heart attacks and strokes. This type of exercise has been linked to a higher VO2 max, a measure of oxygen utilization during activity, and is associated with better physical fitness and lower cardiovascular risks. However, the study acknowledges limitations, such as relying on self-reported walking data. Researchers also note that physical activity levels were measured only at the start of the study, leaving room for future changes. Meanwhile, the World Health Organization estimates that physical inactivity causes around 2 million annual deaths globally, ranking it among the top 10 leading causes of death and disability. In the UK, sedentary lifestyles, including desk work followed by long commutes, contribute to preventable health crises. Experts like Professor Lily Liu urge public health officials to prioritize fast walking in communities with limited healthcare access, emphasizing its role in improving health outcomes. They stress the importance of encouraging daily movement, such as brisk walking, as part of broader efforts to combat obesity and related conditions. Yet, the study's authors caution that while fast walking offers significant benefits, individual circumstances, like access to medical care or safety concerns, may limit its adoption. The debate over whether fast walking is the optimal solution for everyone remains open. While the research underscores its potential, critics argue that personalized approaches are needed, considering factors like socioeconomic status and lifestyle. As the world grapples with rising health challenges, the findings serve as a reminder that small, consistent changes, like a daily 15-minute walk, can have profound, life-saving impacts.